The things that you can do is to start before your first ever surgery. So keep yourself healthy, keep yourself moving, eat well, lose weight, stop smoking, make sure that all of your medical conditions are well optimized, such as your diabetes, your blood pressure problems. Make sure you go and see your heart specialist if you see them. After the joint replacement surgery, follow the instructions that the surgeon gives you and the physical therapist that give you. Make sure that you don't go too crazy too quickly, but at the same time, you don't want to be in bed or sitting in a chair all the time either. If you have a hip replacement or a knee replacement and has been working fine for many years and now you start to get pain in that joint, that's usually the first sign that something might be going wrong. There are other symptoms as well. With your knee replacement, if you start to feel that your knee is wobbly and that you can't trust your knee, your leg's giving out and you may be falling, you hear lots of clicking and popping noises in your knee or your hip, those might be the reasons why you might want to get that checked out. So to determine whether you would need a revision surgery, it starts with me seeing you in a clinic. I get a history from you. I typically want to know when you had your surgery, how long ago, whether there were any problems during that surgery. I want to know your current symptoms, whether things have changed. I will then examine you. I will watch you walk. I will examine your joint. I will examine your circulation system and your nerves to your leg. And I will then look at your x-rays. I might even need further imaging, such as CT scans, MRI scans, or bone scans, depending on your symptoms. Once I have all that information, I can then determine whether your implant is working well or whether you need surgery to replace that joint replacement. Joint replacement can fail for a variety of reasons. They can also fail at different times after the surgery. So there are reasons why a joint replacement may fail in the first few days, weeks, or months after surgery, and then the joint can stay for years before it starts to fail again. So we call that early problems or late problems. The early problems that might need surgery could be if you had a wound problem, an infection, dislocation of your hip, if the implants became loose in the bone because the bone did not grow into the metal, which is supposed to happen in the first 6, 8, 12 weeks after surgery, you would need surgery in the early months after surgery. Another reason why you may need surgery early on is if you had a fracture next to the implant, but that can also happen anytime during the life of the implant. The reasons why you might need surgery many years after the implant was put in is if the implant wore out, if you got an infection that came into your joint from somewhere else, if you had a fracture next to the implant, or if the implant eventually became loose. Depending on what kind of implant you had at the time of the surgery, some implants may fail earlier than others in terms of how it becomes loose within the bone. The goal of a total joint replacement surgery would be to try and get you back to where you used to be when your joint replacement was working well. Doing a revision surgery to get back to where you would have been if you had a joint replacement that was functioning well is what we'd be looking for. But we really want to get you walking and getting you back to an active lifestyle as much as we can. Now, there may be certain activities that you may be restricted from doing, but we definitely want to get you back to where you can do your normal everyday work.